Bismillahirrahmanirrahim. Myself Mohammad Talha Javed, and the topic of my research paper is currently the challenges in accessing the physical healthcare in Pakistan, its barriers and opportunities. So, why I chose this topic was that in the background, that first of all, I would like to tell you that I have completed my FYP, that is on centralized hospital management system, where the patients can online consultation take consultation with the doctor, and uh, involved with the online health checkup, and also take appointments online. So we also created a physical portal for that, where patients can accommodate that opportunities. So the first of all, the introduction that discusses that why I chose this research paper is that there were in the healthcare accessibility is a major factor that is influencing public health outcomes in Pakistan. Currently the healthcare sector is suffering from fundamental difficulties such as uh, insufficient infrastructure, less number of skilled experts, and unfair resource distribution. According to a survey, approximately 70% of the population live in rural areas with a limited access to medical care due to distance and financial restriction. For example, when people have to travel to hospitals and medical institutions, they have to face different challenges, such as poor infrastructure and some financial reason. So that's why this topic has to be raised, and we should work on telehealth projects. So as we know that in COVID-19 pandemic, when it was not possible for patients to go to the medical institutions or hospitals due to restrictions or some lockdowns. So in that way, the telehealth was emerged in different cities and countries of the world. Uh, uh, and next we go to the research work, related work. Before me, there are many topics, different institutions that have worked on this topic, and worked on it. And for example, first of all, we see the Aga Khan University research. According to the Aga Khan University research, the rural population generally rely on the healers and midwives due to limited access to neighboring institutions. And there are also some challenges for women when they confront the specific challenges, in including the need for male chaperone. While traveling, they might delay or prevent timely medical attention. So that's why we have to introduce digital health intervention. So when we introduced the digital health intervention, the telehealth programs are increasing popularly due to barriers such as digital literacy and affordability use. As we know that today everybody uses mobile or laptops to use the social media, and they have such type of literacy that helps them to get their checkup done, or uh, uh, meet their uh, requirements. And other countries like India has successfully used telehealth to improve the maternal and child health outcomes in rural areas. So it is a role model for Pakistan as well. So let's move to the methodology that we used. So we used the methodology that compiles data from secondary sources such as government papers, peer-reviewed journals, and case studies about the healthcare availability in Pakistan. We have combined the qualitative insights and with the quantitative data, and we found the key barriers, and we divided into three categories that are geographic, financial, and socio-cultural. And at the end, we done the SWOT analysis. That is, we found the strengths, weaknesses, opportunities, and threats of the system. What can we do for it? So next, let's discuss on the findings and discussions. Um, uh, as we know that there are geographical barriers. For example, in rural areas of Pakistan, such as Tandula Yar and such kind of low rural areas, there are lack adequate health facilities are available. People have to travel more than 50 kilometers to get basic health services. So that's why it is necessary. Next, we find financial constraints. As we know that according to a World Bank report, 60% of families delay or reject medical treatment owing due to financial constraints. Low-income workers can face significant cost or for beneficial consultation, diagnostics tests, and medicines. And social cultural challenges are also an important discussion that we can do. So, such as cultural traditions, specifically uh, limited women autonomy in obtaining health care. Many women seek permission from a male relative and must be accompanied to appointments. So, it laws may prioritize home task over women health while making medical decisions. And there is a good role of telehealth telehealth services. For example, project of Sehat Kahani that was introduced by government has enabled remote consultations, reducing the need for travel. The initiative also includes the access to female doctors, that reducing gender-related hurdles. So next we move to the recommendations. If we don't have to use the telehealth checkup, we have to do these initiatives to be improved. For example, infrastructure development, like infrastructure development, financial support. We have to engage the community to raise awareness about the importance of healthcare and cultural taboos in the critical communities. Health workers can act as mediators to build trust and promote telehealth adoption. And technology integration is also an important factor that is must have to be used in the medical field, such as for expanding the digital literacy programs and providing affordable smartphones that can enhance the telehealth accessibility and such kind of thing. At the end, the conclusion and the future work is that the challenges that are faced by patients in physically accessing healthcare in Pakistan uh, are deeply rooted in systematic inequities. While telehealth presents a promising solution, its full potential can only be realized through the comprehensive policy reforms and investment and in infrastructure and education. The future research should be explore the long-term outcomes of telehealth initiatives and their scalability in the rural context. This was our research paper, and the resources and references that we used in this are, this is JMIR, that means Journal of Medical Internet and Research. We used this journal for taking some um, references. And this there is a GSMA, that is an organization that helps in improving women health experience in Pakistan. And also we have read the United Nations Conference on Trade and Development, UNCTD, that uses Pakistan youth as a health to change the rural lives of Pakistan. Thank you so much.